Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It's our 10th anniversary of our Health Matters show and our 45th anniversary of our company. Today, we're featuring a program with Medicare's annual open enrollment period, which began October 15th. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Genure Appraisals and Liquidations, and of course, our socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Jack Stahl, personal health insurance agent with Pipes Insurance. Good morning, Jack, and welcome to the show.
Good morning, Paul. Thank you for having me.
If you're becoming Medicare eligible or are currently eligible for Medicare, you know that it's that time of year when you are bombarded with phone calls and letters and all forms of solicitation from different Medicare plans. It's the annual open enrollment period from October 15th to December 7th. One recent study shows that 9 out of 10 Medicare patients are not on the best plan to suit their personal needs. It's not surprising because, frankly, what could be more confusing than selecting the best Medicare plan for you? If you find Medicare confusing or you're concerned that you aren't in the best Medicare plan, our show today is dedicated to you. We want to help you be in that 1 in 10 patients who found the best plan to meet their needs. Please join us today as we learn more about Medicare open enrollment plans. We'd like to remind our listeners today that this program is also available on our podcast. We encourage you to search out Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
Okay, Jack, welcome to the show again. Please tell us a little bit about yourself and introduce yourself to our listeners.
All righty. My name is Jack Stahl. My wife and I are both from Dover. We graduated from Dover High. We went to college, and then after college, settled in Athens, Georgia for a number of years. Came back to Ohio, then went back to Georgia for a few more years. We're back in the area now, hopefully with no plans to leave. I've been in the insurance business now for going on 25 years now.
Amazing. Okay, so during this time of the year, we hear a lot about AEP, and it isn't a reference to our electric utility. What is AEP when it comes to Medicare plans?
AEP does stand for Annual Enrollment Period. It runs from October 15th to December 7th, and it's a time when people that are on Medicare Advantage plans or on a Part D prescription drug plan, they can review their coverages, they can make changes if they want to, that would begin then the next January of the following year.
So what type of changes do beneficiaries make during AEP?
Well, according to the government publication of Medicare and You, they say they can join, switch, drop, or make changes to their plans during this time.
And so what happens if someone would miss the time frame to change during AEP?
Well, if you are on a Medicare Advantage plan, you do have an ended period of time, going through March 31st. It's called the Medicare Advantage open enrollment time. At that time, you can either switch plans or you can drop your plan and go back to the original Medicare.
So let's say I'm happy with my plan. What do I have to do to stay with it?
Nothing really. It's good to kind of annually review what you have, but as far as continuing from 1 year to the next, there's nothing that needs to be done to continue the coverage.
Okay. Why is it important for patients or customers to consider reviewing their plan options?
Well, of course, life changes. And so if you have a situation come up in your life that the coverage that you're currently on maybe isn't going to do the job to cover what's coming or what's developing, you can take advantage of the annual enrollment period to make a change to go to another plan or make a change within the plan that you have. Also, Medicare Advantage plans are a very competitive market, and not only do they offer the coverage that you get either at the doctor or the hospital and the typical insurance type coverages, but they also offer perks like joining a fitness club locally, or offering meals to come to your home after you've been dismissed from the hospital, transportation to and from the doctor, over-the-counter shopping online, teledoc, just various additional things that might make that plan more attractive to you because of your situation. So if you do review your plan then at the end of the year, then you can take those things into consideration and make a change if necessary.
Okay, it's wonderful to have you on the program this morning, because in the pharmacy, we quite often get patients that come in with that deer in headlight look, and they're like, I need to sign up for a plan and I don't know what to do.
Yeah.
So to have an expert like yourself help us with some of the terminology today and some of the options is great. So can you start with something really basic? Like, can you explain some differences between a Medicare supplement plan and a Medicare Advantage plan, and maybe which might fit a patient better depending on their situation?
Sure. Yeah, we get the deer in the headlight look a lot at our office when people come in as well. I would say two things that are the main differences between a Medicare supplement and a Medicare Advantage plan. First would be cost. Medicare supplement plans typically are more expensive as far as an annual output of a premium. So that's one consideration. And then the network is the other. Medicare supplement plans don't require you to use a doctor within a certain network of doctors. You can go to any doctor in the country that accepts Medicare assignment, and you have the same type of coverage you would otherwise. So that's really the two basic differences between the Medicare supplement and a Medicare Advantage plan.
Okay. What is the benefit of having an Advantage plan over just regular a Medicare A and B with your red, white, and blue card?
I would say, in my opinion, the main thing would be with a Medicare Advantage plan, you have a maximum out of pocket typically, which means that you're not going to spend more than X amount of dollars for whatever happens to you, whatever treatments you incur throughout the year. You've got a cap. And that's kind of peace of mind. If you know that cap going in, you say, okay, I can afford that cap. That's very helpful. I would consider that an advantage, as opposed to with original Medicare, it's just an open-ended, you have your deductible, then the 20% that they don't cover can go on, for a long period of time, and that could add up. So there to me is that peace of mind knowing that you've got a maximum out of pocket with a Medicare Advantage plan, and also, as I mentioned earlier, the perks that are included, the transportation, meals, fitness club, that type of thing, even vision, dental, hearing, that type of thing, which are not typically included in any kind of original Medicare coverage.
I think that's important to list, because I don't think a lot of patients realize there's those extra healthcare services that are part of some of the Medicare Advantage plans. I mean, it really becomes almost more of a complete coverage product when you're able to roll in hearing and dental and some of those things. So I think that's pretty slick. So definitely good to ask questions about that.
Right.
All right. So that's the good things. How about, what are some disadvantages of having an Advantage plan over original Medicare A and B?
Well, in my experience, when I am sitting in front of somebody in my office and we're discussing the differences between the two, the thing for a Medicare Advantage plan that would be considered the disadvantage would be the restriction of a network. And typically, I mean, if people come in, one of the first questions I ask them is, do you have a home in Florida that you stay at 6 months of the year? Because if you do, Medicare Advantage plan is not for you because of the network restriction. You'd be out of network half of the year and wouldn't have things covered on a non-emergency basis. So I think that's probably the biggest disadvantage of the Medicare Advantage plan, just the restriction of having to stay within a network. Some people, it's not an issue, but others look at it as a negative impact.
So what does somebody do if they're faced with the problem of having a doctor or a provider that they really respect and want to stay with, but they're not in the network of their Advantage plan?
Well, if you have, it depends on the kind of Advantage plan you might have. If you have a PPO Advantage plan, you would probably still have some kind of coverage with that doctor, even though he or she is not a network doctor. Of course, out-of-network benefits are not nearly as comprehensive as the network benefits are. That's why they do that, to give you an incentive to stay in the network. If you have an HMO type of Medicare Advantage plan, then if your doctor is not in the network, then you would be responsible for the entire financial charges that you would incur at that doctor's office.
Why in the heck did they make it so? Why in the heck did they make it a compute? I want to say damn, but why did they make it so confusing? I mean, you know, most people that are on Medicare obviously are retired, and you know, they're just looking for a net or something to make sure that their retired days are comfortable and healthcare is good. You know, so
Yeah.
I
Well,
don't get it.
they do make the Medicare and You booklet in large print, so they've really taken that into consideration with the demographics of the people they're working with. They like large print, but other than that, yeah, it's not something that's very easily understood.
Okay. Our first break is here, Jack. You're listening to Health Matters with the Medicine Center Pharmacy. Okay, welcome back to Health Matters with the Medicine Center Pharmacy. Flu vaccine along with Moderna and Janssen COVID vaccine are available. Please stop by any of our stores to get vaccinated. No appointment necessary. So Jack, you just talked a little bit about what happens if I'm on an Advantage plan and retired for the winter. What about for a couple weeks or a vacation or where are we at there?
Well, typically, if you're just visiting somewhere for a short period of time, if you have some kind of medical treatment, it's going to be on an emergency basis. In that case, you do have coverage with a Medicare Advantage plan anywhere in the country. If you are admitted to or go to an emergency room, you realize coverage that way. So that is helpful. I think that's one of the redeeming aspects of a Medicare Advantage plan, because virtually everybody travels at some point, you know, and if they
Sure.
knew that once they went outside of their region network and they had no coverage at all, that wouldn't be a big seller. So that does help. If you know, even though you don't spend a lot of time, a month, you know, at a certain spot, but if you're going to be there for a few weeks, you have a emergency, you would realize coverage under a Medicare Advantage plan typically.
Okay. I got to go into the hospital while out of network. Is that covered?
Well, again, if it's a hospitalization that's a direct result of an emergency visit or an urgent care visit, typically, yes, that would just fall under the network benefits of your plan, and you would pay your copay, and that would be it. But if it's not considered an emergency, then no, you would not have a coverage under a Medicare Advantage plan outside the network that way.
Okay. How about if I join an Advantage plan and don't like it? Am I stuck with it forever?
No. One of the very definite advantages, I should have maybe mentioned this previously when you asked me about advantage of a annually, you can take advantage of this AEP, this annual enrollment period, where you can drop, switch, join your plan. So if something has happened throughout the year that's caused you to think, you know, maybe I'm not in the right plan, you do have that opportunity at the end of the year to review what you have, compare that to what's out there, and then make a change that would begin January of the following year.
Okay. So what about Part D coverage? That's the prescription end of the Medicare programs.
Well, when you mentioned about why do they have to make it so doggone
You can use a
complicated,
word. It's okay.
even as an insurance agent, I still have to use notes when I refer to the Part D coverage specifically. There's four aspects of the government's Part D coverage. You have your deductible phase. This year is $435, I believe. The next phase, after you satisfy that, then you have what's called an initial coverage limit. And that I think goes up to $4,020 or something close to that this year. Then the third phase is the donut hole, and then the fourth phase is the catastrophic phase. So it's convoluted, um, but there's some logic to it, I would guess. But it does have the four phases, and every prescription drug plan, whether it's part of a Medicare Advantage plan or a separate Part D plan, they all are regulated by that same outline of four phases: deductible, initial, uh, donut hole or coverage gap, and then the catastrophic.
One of the, when the patients come in the pharmacy and they are, again, we said deer in headlights, it's not to insult the intelligence of our patients or customers of Medicare plans. It's just sometimes the lingo and the language and the structure is confusing, and the donut holes and those gap periods and the deductibles are challenging for them all to keep track of. So, at the pharmacy level, we try to help them navigate their plan as best as we can. Sometimes it's a challenge, but, we can often help them look at some of their medications and try to help them find more economical choices by working with their doctors. But a lot of times it comes down to making sure that you talk to your pharmacist or an insurance professional like Jack to make sure that you start yourself off with the best intentions. So I think that that's one thing that we would encourage you to make sure if there ever was a chance that there were no dumb questions, please make sure that you ask questions of your insurance professional or your pharmacist to try to make sure you make the best informed decision before you lock yourself into a plan that you might find out doesn't cover half the drugs that you're on. That would be a real problem. So, but all right. Before we get going into your next subject about formularies, I think we're going to need to talk about that after the break. So do you want to lead us out for the commercial break?
Okay. It is the bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. We're talking with Jack Stahl, personal health insurance agent, personal, that's right, agent with Pipes Insurance. We have a lot more to cover this morning, so let's get back to the show.
All right, Jack, I think it's time we talk about one of the most challenging things for patients on a Medicare D plan or Advantage plan, and that is your formulary. It's another scary word that Medicare or most insurance plans use. And what can you advise patients about to find medication on the formulary for the plan they're picking? It can be challenging. What are your recommendations and guidance?
Well, typically when I'm sitting across the desk from someone and we are discussing the Medicare Part D plans that are available, we go to medicare.gov together and we click on the links that would lead us to find a Part D plan. A formulary is a very important consideration, simply because you're buying a plan that's going to help you pay for your prescriptions. Those things can vary from very inexpensive to very expensive. And one thing I do like about the way it's set up online is they allow you the option of putting in the drugs that you use and all the details of it, the dosages, how many times a day, all that. And then when you submit that list, however long it might be, the algorithms kind of take over and they will narrow down the 28 plans that are available in your county or whatever it might be to a handful. And then that gives you a better idea of the plans that will actually cover either just cover your prescription or cover it better than some others. So formulary is simply a list. The word formulary does sound a little bit intimidating, so you could just consider it a drug list. And every company has the option of covering. They're mandated to cover certain drugs or a certain number of drugs for various types of needs, but they do have a lot of flexibility as to which drugs they're going to cover and how they're going to cover them. So the formulary is what gives you that information when you're making your decision for your Part D plan.
Hey, what about this? In the early days of the Medicare changes, some of the programs, Part D programs, change their formulary in the middle of the sign up year, if after people have signed up, is that something they cannot do anymore, or?
To my knowledge, they are allowed to do that, but they have to give, I forget the exact wording, but they have to give you a notification ahead of time, well ahead of time, so that you can make um, changes if you're able to with your doctor. And also then they are required to receive appeals if your doctor says, nope, we can't go to the generic of that drug, or we can't use this drug instead of this drug. They are required to entertain or receive appeals from their beneficiaries with the doctor's okay as well, to make exceptions for them, maybe until the next open enrollment period where they could make a change in their plan. But as far as I know, they are still allowed to make a change, that they're going to drop a drug or change the tier of a drug or something within the year, but they do have to make that known well ahead of time.
Yeah, you know, formularies are a challenge. And in theory, it's my understanding from the pharmacy side that every drug class has to have some options in it.
Right.
So that would mean that, you know, if you're taking drug A for cholesterol, there has to be at least a couple options in that drug family that are the same kind of medication in the same class that are covered.
Right.
They may not cover drug A, but they might cover drug B, C, and D. So, and in theory, they're supposed to be therapeutically equivalent. But you're right. Sometimes there are changes throughout the year. I don't think they're as egregious as they were in the beginning of the program. I feel like now they are a little more realistic. You highlighted a generic option. So maybe in the first half of the year, there was only a brand name drug for, you know, your blood pressure medicine. But in the third quarter of the year, the generic came out. Well, they might stop covering the brand name because the generic's out now. So hopefully it's a change like that. But you're right. The appeal process is there so that your patients and your doctors can work together to try to meet the patient's need for the best patient interests.
Right.
So let's talk about another scary term. Let's talk about the donut hole and how it relates to Medicare D coverage. Can you explain what the heck the donut hole is and if everyone actually falls into it?
Well, like I mentioned a little bit earlier, the plan itself has 4 phases. The coverage gap, or the donut hole, is the third phase. Once your copay, your deductibles and your copays in the first 2 phases add up to $4,020, then, or maybe it's $441.30, something like that. It changes a little bit every year, but over $4,000, then you are in that coverage gap, or the donut hole. And at that point, originally you just assumed all coverage, all financial responsibility. Since then, they have tweaked it so that at this point, at least the last information I have, said that the beneficiary would pay 25% of the plan's cost for brand name and 25% of the plan's cost for covered generics during that coverage gap portion until their out-of-pocket reached $6,550. With all those expenses combined, once you've paid $6,550, then you're out of the donut hole, out of the coverage gap, and then you're into the catastrophic phase. It's where you would have more of your financial output in that particular phase of the coverage. And in my experience, the vast majority of my clients don't ever reach that. But there are some who reach it right away. I mean, with the variation of drugs costs, some people could reach the coverage gap in January, you know, after their first regimen of medications is purchased. But they also would exit that coverage gap soon at that same rate, and then they'd be in the catastrophic phase for the rest of the year. Yeah, that's I don't know. I always say, tell my clients, it was designed by a politician, and it seems kind of obvious when you try to break down the 4 phases and get all the coverage limits and limitations and all the other things. It's just like, who sat around and thought about this? But to the best of my knowledge, that is
Yeah, right. Did they think about it?
yeah. Did they think at all? Yeah, that's a good
Yeah,
point.
right.
But that is it's the 3rd phase of your Part D coverage under your Medicare Part D coverage.
All right. So let's I'm looking for relatables. I like things that try to help maybe help people understand something that's really complex. And that may not be easy with these Medicare plans. But can you maybe give us an example of what coverage would be like with original Medicare, and then compare it to what coverage might be like with an Advantage plan? And it could be anything. It could be a hospital stay. It could be a doctor visit, or can you give some examples maybe?
Well, yeah, original Medicare, doesn't cover any prescriptions unless they're administered in the hospital. So we're looking at hospital visits or doctor visits and comparing that to what an Advantage plan would offer. For instance, if you went in the hospital for 2 days, typically you're going to meet the Part A deductible, which I think this year is $1,408. You'd meet that within the first 20 minutes of being in the hospital. So if you're in there for 2 days, you're going to pay $1,408 with just original Medicare. Then they do have the certain coverage for days 1 through 60 and that type of thing. But you'll have that immediate out of pocket with original Medicare, $1,408 right off the bat. On the other hand, if you were a Medicare Advantage plan, typically, I'm speaking pretty much from my own experience. The Advantage plan I'm on, days 1 through 6, I have a copay per day for those days. Mine is $275. So in 2 days, I would have what, $550 out of pocket rather than $1,408 on the deductible with original Medicare. So in that case, the Advantage plan would be a benefit to me. If you go to the doctor's office, original Medicare has a $203 annual deductible that you would need to meet. So if all you have is original Medicare, you pay the first $203 of a doctor's visit. It may take you 2 visits or more to get that, but you would be responsible for the first $203. On my Advantage plan, I just put down $5 when I go to my primary care physician and I'm done. So if I went 2 or 3 times, I'd have $10 or $15 as opposed to the whole charge for the doctor's visit. So in that way, I'm not being partial to it. I'm just kind of stating it. In these situations, a Medicare Advantage plan would be more beneficial to the client than just original Medicare.
I think the whole thing is just crazy. The more I listen to it, we have a lot of people who come in for a review, but then again, there's a lot of people who just, even though we show them some positives of a switch, they just, I believe the confusion level is so heavy that they're just afraid to, afraid to change to another Medicare program.
Yeah.
So what do we do with those people?
Well, like you mentioned earlier, the confusion leads to uncertainty, and uncertainty tends to make people not want to go beyond their comfort zone. And if they know original Medicare and that's all they know, that's all they want. Yeah. Sometimes they're just in that mode.
Okie doke, Jack. Our final breaks here. You listen to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of the show. So, excuse me, folks. All right, what are some of the benefits on an Advantage plan that you don't get with original Medicare? I think touched on these a little earlier.
Yeah. I guess specifically, I would say the fact that a Medicare Advantage plan has an out-of-pocket maximum. With just original Medicare, you have your deductible for hospital, you have your deductible for doctor's office. Medicare pays their 80%, but you've got that 20% looming there that could just go on and on and on. And that could lead to some pretty expensive out-of-pocket for you, as opposed to the Advantage plan giving you upfront, okay, if you pay more than X amount of dollars, you're done for the year. And so that, I think that is a real advantage of the Advantage plan. Plus the idea that original Medicare, especially with hospitalizations, it's not an annual deductible, it's a benefit period deductible, which means that it starts the day you go in the hospital, and that benefit period ends after you've been out of the hospital and not returned in after 60 days. So depending on when your hospital stays are throughout the year, you could incur that $1,408 deductible several times in the year. Again, the Medicare Advantage plan doesn't have that type of thing. They've got that maximum out of pocket. They've got copays for things, and it's just a little more structured. And I think it just gives a little bit more clarity to your understanding of what you're actually getting as coverage for your plan. So I think the out-of-pocket cap and the fact that the RX is included at no extra charge, typically, there are some Medicare Advantage plans that don't include RX, but every one that I've ever enrolled in and went into included a Medicare Part D plan in it with no extra charge. So they don't have the extra amount out of pocket for premium for a separate Part D plan.
Let me run this by you. I think we talked about this too, but what would be a reason that one would switch from a Medicare supplement to a Medicare Advantage plan?
Well, I think foundationally it would be talking cost. My experience has been over the years that Medicare supplement plans do increase. That's not just my experience. That is pretty much everyone's experience. The cost will increase on an annual basis. If you live long enough and you maintain your same Medicare supplement plan for long enough, it may eventually get prohibitive. One advantage of the Medicare supplement or Medicare Advantage plan is that there's no medical underwriting ever. So if you start out with a Medicare supplement plan and you're on it for several years and you develop a very serious condition, cancer or very serious heart problems, or something that would ordinarily cause you to be declined with medical underwriting, you don't have an option to change your plan to another supplement plan because of that physical condition you're experiencing. However, you always have the option to go back or over to a Medicare Advantage plan because there's no medical underwriting at all. So if it comes to the point where the cost is prohibitive on your Medicare supplement plan, you do have the option, regardless of your health, to go back to a Medicare Advantage plan or just go to a Medicare Advantage plan for the first time with no medical underwriting. So I think that's a big advantage and a big reason why people would make that switch.
All right, Jack, how about you share your contact listeners for our listeners and patients? And we appreciate you joining us today. So we want to make sure that everyone can reach out to you if they have questions.
Sure. Our office is located at 442 West High Street in New Philly. My personal direct desk line is 330-403-6615. And we have two of us here. Bob Victor is the other gentleman at our office that does the exact same thing that I do. And so I would either answer the phone or Bob would answer the phone, but both of us would be able to help people, or they could stop in at 442 West High and talk to us personally.
So how about this? We've covered a lot of info today. How about you take a minute to wrap up what parting thoughts to leave the listeners with about what's important about going through this open enrollment period?
Okay. Well, first, I would say that if anyone is reaching the age of eligibility for Medicare, they've probably received or will receive that Medicare and You booklet from the government. I would recommend that you not throw that away. I refer to that constantly, and I'm doing this daily, but there's still just little things that booklet helps me with. It's got large print, which is, I'm really to the point where I appreciate that myself. But I would encourage anyone who's thinking about Medicare or is in the process of enrolling or is on Medicare, keep that booklet handy. That's a very helpful resource. And also, I would just leave them with the idea that we are here to help. Bob, Victor, and I both are able to answer any questions they might have. We don't pressure people into signing on the dotted line. We just are here to answer questions. And we're here to also then provide insurance products that are tailored to anyone's individual specific needs. And we're more than glad to do that.
Okay. Okay, thank you to our guest, Jack Stahl, personal health insurance agent with Pipes Insurance. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, Genure Appraisals and Liquidations, and of course, our technical producer, JD DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. And we will see you right here next Friday on News Talk 1480 WHBC.